It's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today's tip is, again, answering a question from one of our members in our membership for families of critically ill patients in intensive care at intensivecarehotline.com. You can go to our membership section there, or you can go directly to intensivecaresupport.org. So let's read out a question from one of our members who says, "Hi, Patrick and team. My husband's tube feed is from a pump. He gets 80 mils of formula per hour and 100 mils of hour every 8 hours. I was informed by the dietitian that he was getting Benetrol in his tube feeds, but they intend to stop it since his stool is now okay. Today he worked with the speech pathologist and the physical therapist. He sat up at the side of the bed. I know they should be working with him more than once a week. I requested the debridement of his wound, so the doctor will get back to me about this. I requested a transfer to another hospital or to be discharged for home, but I'm getting the runaround. He has good breathing, no fevers. His inner cannula of the tracheostomy is changed 2 times a day. Is this sufficient? He was given melatonin last night to help him sleep. I didn't like the side effects on him, and he has no sleeping problems. He was alert, responsive, and mobilized today, but it should be every day. Thanks for your response." So here is our response. I hope that you are well. Thank you for your email and the updates about your husband. We are very glad to know that your husband is doing well with his breathing, has no fever, and is tolerating his tube feeds. Those are good signs of progress. We pray and hope that your husband finds strength with each new day and brings him closer to a full and speedy recovery. If your husband has no problem with his stool, no diarrhea or loose stools, the Benetrol can be stopped or discontinued because Benetrol thickens the stool and helps to reduce the bacteria in the stool. It is nutritional support for the management of diarrhea or loose and watery stools. To improve your husband with his bowel problems, can also include bananas in his feeds. You can have it blenderized and mixed with his feeding formula because the banana is the best aid during loose motions. Also improves bowel irregularity, and the potassium in bananas is good for your husband's heart and blood pressure. If your husband has a good tolerance to feeds, ask the doctor and dietitian to assess if it is possible for your husband's feeding to be shifted gradually to bolus or a septal syringe feeding, for example, 240 mils of feeds every 3 hours or 160 mils of feeds every 2 hours, as your husband can tolerate it. Once started with bolus feeds, aspiration precautions are to be observed, of course. Bolus feeds gives time for the stomach to rest, more convenient for the patient with no need for a feeding pump and freedom of movement for your husband. If he tolerates the volume, then it can gradually increase accordingly. It is very good to note that your husband's participating in his regular sessions with a physical therapist and speech-language pathologist. These regular therapies and exercises will greatly help your husband with his fast recovery and avoid further complications like contractures, nerve paralysis, etc. When your husband's wound was assessed by the doctor and recommended for debridement, is that coming from the doctor? To promote wound healing, daily dressings of the wound by the wound care nurse must be done aseptically, and prescribed medicines such as antibiotic cream, ointment, surgical supratool, Bactigras dressings to apply and place. Strict prevention of infections by doing the hand washing, wearing of gloves, etc., and nutritious diet, feeding formula to be prescribed by a dietitian that helps in your husband's wound healing and body repair and restoration. Now, I would also suggest that with him having diarrhea, there's a very high risk of an infection that stool might be entering the pressure area, and that could cause sepsis. So be very careful there that they are really maintaining good hygiene and giving him very good nursing care. Now, you requested for transfer to another hospital or home discharge. Has your husband been assessed by the doctor and is fit to be discharged? Now, I do know that your husband still has a tracheostomy, therefore he can't really go home unless he has 24-hour intensive care nurses at home. because he needs someone with him 24 hours a day that is tracheostomy competent. Now, you also asked if changing the inner cannula twice a day is sufficient. Look, it really depends. So when the inner cannula is changed, someone needs to look at, is there a sputum plug? Is it soil? Right? So if the inner cannula is changed twice a day, then, and if it's not soiled, that is sufficient. Now, if the inner cannula is changed twice a day and it's soiled, heavily soiled, and potentially narrowed in diameter, then it's not often enough. The risk for a sputum plug then is real. So, therefore, it's, is it often enough to change it twice a day? It all depends. So, and therefore, your husband should not be discharged without having 24-hour nursing care at home with critical care nurses that are tracheostomy competent. So, you can't be discharging your husband prematurely here, otherwise he'll just bounce back into hospital. So, also, are your husband's vital signs normal and are they maintained? Have they recently checked for his bloods, white cell count, red blood cells, electrolytes, etc., etc.? Are the results of blood investigations and culture results good and normal? Has he completed his antibiotic treatment? We are looking forward to your response, and it is to be continued here with another question from our member. Now, thank you so much for watching. If you want to become a member and get the same questions answered or similar questions answered when you have a loved one in intensive care, and you want to have access to me and my team, then go to our intensivecarehotline.com website and go to our membership section on the website and sign up for our membership for families of critically ill patients. You can also access it directly through intensivecaresupport.org. There you have access to me and my team 24 hours a day in the membership area and via email. And we answer all questions intensive care related. I also offer one-on-one consulting and advocacy over the phone, via Skype, via Zoom, via WhatsApp, whichever medium works best for you. And I talk to doctors and nurses directly. I also represent you in family meetings with intensive care teams. And I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one in intensive care critically ill, so that you can make informed decisions, have peace of mind, control, power, and influence. Now, we also offer medical record reviews in real time, so that you, once again, can get real data evaluation in real time and a second opinion in real time, once again, so that you can make informed decisions, have peace of mind, control, power, and influence. Now, we also offer medical record reviews after intensive care if you have unanswered questions, if you are simply needing closure, or if you are simply suspecting medical negligence. Now, for any of those services, contact us at intensivecarehotline.com, call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. Now, if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, or what questions and insights you have from this video. Thanks for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.